Flu, COVID, and RSV. There are 3 different respiratory illnesses impacting people this season, and doctors are seeing a concerning increase in hospitalizations at UCHealth. Epidemiologists say their modeling suggests we're not even near the peak in hospitalizations, and they are projecting a bigger increase over the coming weeks. At UCHealth, Dr. Michelle Barron told me usually it's a slow start to flu season, but this year they went from nothing to hundreds of cases in a very short period of time. Have you guys ever really been in a situation where you have this trifecta of respiratory illnesses?
The challenge now is, of course, you don't know what it is automatically. Like 2 years ago, everybody was like, oh, you got COVID. And then we would figure out what to do. But it could be COVID, it could be flu, it could be RSV, because it can affect some people pretty severely. And so I think that obviously adds another layer to this. And we've had a couple of people who have had more than one, which is not great.
Dr. Barron says the best way to protect yourself and your family is to get vaccinated for COVID and the flu, especially before holiday gatherings. Wash hands frequently and wear a mask. This last one may be tough. She says if you have very young children or are caring for aging adults, be firm about not having family visit who are ill.
And with more of these reported cases of respiratory illnesses, we want to remind you about the paid sick leave under the state's Healthy Families and Workplace Act. Colorado employers are required to provide public health emergency leave on top of the accrued time off. And this leave expanded last month to include flu and RSV in addition to COVID.
Boulder County is moving back into a high community level for COVID-19. You can see on this interactive map from the CDC, the area is one of 16 counties across Colorado at high level because of a rise in virus cases and hospitalizations. Now, this means those communities are encouraged to wear masks in public, especially those who have a compromised immune system or are over 60. People are also encouraged to get vaccinated and stay up to date on boosters.